Regardless of who you are, you have probably been affected by a behavioral disorder. Behavioral disorders are very commonly misunderstood, and unfortunately, autism is one of the most misunderstood ones. A lot of people think that children with autism all exhibit the same signs and attributes, but that is a far cry from the truth. Autism, otherwise known as autism spectrum disorder, is a behavioral disorder that varies immensely from person to person. My brother has autism, so I have firsthand experience when it comes to dealing with someone who has autism. Along with that, I have also done various forms of independent research when it comes to the behavioral aspects of autism. Today, I'm going to talk to you about how autism is identified and diagnosed, the different ways to treat autism, and how it affects people from their day-to-day life. Signs of autism can appear as early as 3 years old. These sort of symptoms can include echolalia, which is the repetition of various words and sounds, the repetition of different actions, a regression of speech or words that have already been learned, or a lack of speech at all, and as well as a few more things. A child with autism can be diagnosed even if they do not experience all of these symptoms, but a child who does not have autism can also experience one or two of these. So it is very important that if you believe that your child may have autism, you want to get a professional diagnosis. As far as statistics go, one out of every 59 children in the United States have been diagnosed with autism spectrum disorder. Along with that, boys are 5 times as likely to be diagnosed with autism as girls. Now, autism can be treated through various forms, but it actually cannot be cured. In order to lessen some of the effects of autism, there are behavior programs, education programs in school, as well as in some cases medication. Behavior programs such as ABA, occupational therapy, behavioral therapy, and speech therapy can all be used to help somebody with autism depending on the needs that they might have. In school, an education program called an Individualized Education Plan, otherwise known as an IEP, can be used in order to better a child's experience in school. Principals, counselors, teachers, special education teachers, and the parents of the child with autism all come together as a team in order to develop a plan that is effective for helping their child succeed in school. Medications are very seldom used when it comes to dealing with autism. The main times that they're used is if there is another side condition that typically comes with autism. Some of those conditions include anxiety, depression, obsessive compulsive disorder, and insomnia. While all children with autism typically vary in terms of their symptoms, there is one thing that does happen to a majority of them, and that is their social capabilities. A lot of times, kids with autism, their brains are wired in a different way, making it more difficult for them to succeed in social situations, whether that be a one-on-one conversation or a discussion with a lot of people. In this picture, for example, you can see how easy it is for a child with autism to get overwhelmed in just a simple conversation. It becomes very easy for them to default to saying something that they feel very comfortable with, as opposed to actually answering the question that was asked to them. Sometimes children with autism can come across as rude or aloof, when in reality they are just trying to make themselves comfortable. If you find yourself dealing with someone who has autism, it is typically better to just be patient and as direct as possible. Things such as sarcasm do not typically go over well with somebody who has autism. Today we discussed how autism is identified and diagnosed, how autism can be treated, and how to deal with someone who has autism. When it comes to learning about the things that autism can do and how to deal with them, resources such as autismspeaks.org are very wonderful resources when it comes to learning how to deal with autism. If everyone in the world could understand a little bit more about autism and how to make those people with it feel more comfortable, this world would be so much easier for those who are affected with this behavioral disorder.